Hey everybody, it's Dr. Christopher Wellwood at the Regenerative Medicine Institute. Today I'd like to talk to you about a patient that we had seen earlier that I think you guys might enjoy. One of the things that I talked about in my prior blogs was scar tissue treatment. And I just touched on it briefly. And one of the things I thought I'd like to talk to you about today is that scar tissue oftentimes is extremely painful. Now, there's various techniques to actually treat a scar, whether that's a C-section scar, which is probably our most common treatment here, or whether it's a post-surgical scar to fix a piriformis issue, or ankles, which we see a lot of as well, or shoulders. Anything that is basically cutting into your skin can create scar tissue. One of the things that we find is that scar tissue becomes chronically irritated and chronically painful. That's not because the surgeon did anything wrong. They did absolutely everything correct in the majority of cases. The problem is that some people have altered healing capacities. One, because I know we talked about cortisol before in adrenal systems, it could be an altered cortisol issue. Two, they could have a connective tissue disorder. Three, they could have a genetic issue such as African American or Ashkenazi Jews, which basically takes the scar tissue and blows it up. Four, they could have just had multiple surgeries in the area or decreased oxygenation. So what I oftentimes see in my chiropractic practice as well as in the regenerative medicine world is that scar tissues adheres. So what I mean by that is that instead of it looking like this and them fitting together very easily, they shrink, they twist, they deform, and they basically kind of glue together. Now when they glue together, you can see just if my hands do that it doesn't move very well, whereas normal tissue moves like this. So scar tissue adheses together, and during the formation of scar tissue, the body doesn't know what's going on. So it tries to figure out what's going on by throwing very small nerves that basically sense the area, and it cocoons it. So it encircles and encapsulates that scar tissue. And when those nerves don't go away, then we have a lot of pain due to the scar tissue adhesions. So what we have done prior with physical medicine is your acupuncturist will go in there and needle it. Your massage therapist, your physical therapist, and your chiropractor will go in there and then we'll do what's called cross friction therapy. So we'll kind of scrape it along the side. You can do Graston technique, which is taking a big silver looking tool and they'll scrape it and basically to get rid of those adhesions so that we can get increased blood flow and those nerves can go down and lo and behold you have pain relief. But when you have a scar that you can't do those with, then Prolozone might actually be a fantastic way to help you heal. Whether it's Prolozone itself, so using ozone to actually stimulate stem cells after we break it up, or PRP, platelet-rich plasma, to increase growth factors, or if we use neural prolotherapy to regenerate the nerve damage around there, and thereby reducing the ability or the body's need for those adhesive nerves. So there's lots of really neat therapies that we can do. But one of the things that I prefer to do is with any type of adhesion, whether that's scar tissue or iliotibial band stuff, that's the thing that runs along down your thigh, whether that's adhesed, or even chronic muscle spasms, is that I'm always going to go right back to this because this stuff works amazing, is we use Prolozone. Now, why does Prolozone work so well on scars? If you have that adhesion in there, if I can twist my fingers back there like that, you're not getting a lot of movement, which means you're not getting a lot of blood flow, which means you're not healing it very much. So one of the things that ozone works with is ozone is a gas. So when I'm injecting, I'm actually injecting a gas. So if you're like this and I actually inject right into that scar tissue a gas, what does gas do? Gases expands, right? They expand and they make things bigger. So we are breaking up adhesion. So when we inject it, we actually expand it, and it does this, and it unfolds itself. So it's not necessarily like we're breaking things up, which we are, but we're actually unfolding the damaged tissues, and that allows the stem cells to actually go in there and replace and regenerate them as they should occur. Um, Increases blood flow, increases oxygenation, increases what's called arteriogenesis. So that's basically the arteries and the veins started going there. So that's one of the benefits of actually getting Prolozone, is that it expands that area that's damaged and crunkled up and causing a lot of the pain. So if you have scar tissues out there, I expect a call. So not only because it will reduce that inflammation and that redness that you're probably noticing, but all those painful things when your kids jump on you because your C-section's really, really tender, or if your dog puts his paws up on there, and you're noticing that you're actually having scar tissue pain, then I hope you call me. This is Dr. Christopher Wellwood at the Regenerative Medicine Institute. Don't hesitate to call me at 509-299-6900. Yours in good health.